is Robin Barr, and I'm going to be covering the concept of uncertainty. Uncertainty is defined as the inability to determine the meaning of illness-related events and accurately anticipate or predict health outcomes. Description is as follows. Events that may cause uncertainty include increased physical symptoms during active treatment, lack of medical information, difficulty understanding treatment choices, and changes to daily routine. These changes oftentimes are long-term and are found to be challenging to cope with by survivors and their family members. Uncertainty is recurring depending on the exacerbation of illness and may ease over an extended period of time, but it has been determined that the worst is when the patient is first diagnosed with the illness or disease. Attributes. There are 6 major characteristics of uncertainty according to McCormick 2002, which include ambiguity, vagueness, inconsistency, unfamiliarity, unpredictability, and lack of information. These characteristics are all situational and are not directly related to uncertainty itself, as each individual may perceive these in a different way. The 3 attributes of uncertainty are probability, temporality, and perception. Each of these attributes may present one or all 6 of the major characteristics I listed above, and they can be seen all at one time depending on the complexity of human perception. Probability is often distorted by those in uncertain situations in order to deflect events which are perceived as threatening or having a negative outcome. Temporality is the ability to plan ahead or solve problems. A lot of times this can be seen when patients' family members are attempting to solve problems based on situations that have not yet arisen. Perception is the initial step in the onset of uncertainty and is the beginning of the search for clarity, predictability, and stability. Perception is based on the understanding and expectations related to events which may occur in the present or the future. Antecedents. Antecedents are situational and may occur prior to the induction of uncertainty and include the stimuli time frame, which would include symptom pattern, event familiarity, and event congruency. Cognitive capacities and structure providers, which are information from the healthcare providers and other credible authorities, social support, and education. One of these 3 antecedents must be present in order to spark uncertainty in a patient, and can change from person to person depending on their understanding, experience, and expectations of the given situation. Stimuli time frame is related to the new illness-related stimuli, which leads to uncertainty when patients are not familiar with the experience. These stimuli and events may be related to symptoms, healthcare environment, inconsistencies with experience, and treatment activities. Zhang 2017 states, individuals' cognitive capacity will also determine their interpretation of events and may influence how stimuli is processed. For example, a person with a strong cognitive capacity will reduce their uncertainty due to the ability to understand and process stimuli with ease. Structure providers also determine how an individual processes illness-related stimuli as education. Support among peers and family, and support from the individual's healthcare team may ease uncertainty over time. Consequences and outcomes. Consequences of uncertainty can vary widely from patient to patient based on their particular experience and can be interpreted differently depending on the patient's cognitive capacity, educational level, ability to cope, and adapt. Consequences of uncertainty as appraisal of uncertainty, coping with uncertainty, and adaptation to illness. Appraisal, as stated by Zhang 2017, is the ability to cognitively process and use information provided to determine a stressor as a danger or an opportunity. Danger would be considered a situation which presents as a negative outcome, while opportunity could be a coping strategy to reduce uncertainty and achieve a positive outcome. Coping with uncertainty is the mental and physical aspect of managing stressors, as stated by Zhang. There are many different coping strategies, and these are very patient to patient, but the 2 main strategies in the appraisal of danger are mobilizing strategies, which include information seeking and direct action, or affect control strategies, which also include emotional disengagement or emotional support, while opportunity appraisals may use coping strategies such as buffering, which would include avoidance or selective ignoring. Adaptation to illness is determined when the patient may achieve a new life balance after adequate coping is developed, as stated by Zhang. Not only are these patients affected by uncertainty, but their family members and partners may be as well. Stress management can oftentimes be difficult for patients and can change the dynamics between a patient and their partner, negatively impacting their ability to cope as a couple. It's important that we as healthcare providers can assist families and partners in seeking training for uncertainty management to improve coping abilities and patient outcomes. Application to professional nursing, reducing uncertainty. In this study by Lamon, motivation and expectations for seeking second opinion oftentimes come from not understanding the first opinion they're given by their healthcare provider. Their perceived medical outcome, psychological consequences of second opinions over time. Lamon states patients' uncertainty was reduced directly after consulting for a second opinion, particularly if the first opinion was not confirmed. The study goes on to say that typically highly educated patients are more often the ones to seek a second opinion versus those with a generic oncology setting or lower education. Application of professional nursing, avoidance of illness uncertainty. In this study by Aldaz, avoidance of uncertainty was tested to be determined whether there is direct correlation between uncertainty, daily avoidance, and daily treatment-related distress by following 31 oncology patient treatments, daily diaries. This study proved, as hypothesized, patients reported increased distress related to treatments with a significant decrease in well-being on the days where avoidance of illness uncertainty was at its highest. Application of professional nursing, illness uncertainty, coping, and quality of life. Guan discusses in this study how illness uncertainty is a significant source of psychological distress that affects a patient's quality of life and may directly influence their coping strategies. In this study, 263 patients with multiple types of prostate cancer were analyzed by measuring uncertainty, coping, and quality of life with Michel's Uncertainty of Illness Scale. Guan states that the results proved that illness uncertainty and reduction of avoidant coping strategies directly affected the improvement of quality of life. Application to my practice. So in my practice, I work in long-term care. A lot of times we deal with patients that have Alzheimer's, dementia, cancer, and typically are on hospice care. All these are long-term illnesses. We handle them in facility. Family members are frequently involved, and we oftentimes have specialty care team members such as PT, OT, and hospice staff, even infusion centers as a part of our care teams. It's our goal typically as care staff to educate families and patients as much as possible and within their realm of learning, considering we are an Alzheimer's dementia unit, to the best of our ability to ensure that the education is up to par. We try to include as much education on coping strategies, our care information, and care information on the disease process and anticipation of future treatment-related events which might occur. Future implications. The main implication that can be taken from the concept of uncertainty is, as a care team member, it should be our goal to properly educate and take the time to explain future treatment-related situations and care information which directly affect the patient's understanding of the illness and their ability to cope with events which they may not be prepared for. We need to be proactive and forward with our education and be understanding that these events which a patient may face are frightening and often distressing when they are unknown. Summary. Understanding, acknowledging that there are significant factors that go into uncertainty is important for us nurses and other care team members, as it allows us to further educate and understand and recognize when intervention and anticipation of assistance is required. The goal of nursing care is to help the patient succeed in becoming a healthier and happier patient, which is holistically, and assisting their family to improve their coping strategies by recognizing the 9 major characteristics and attributes of uncertainty. References are as listed.